First of all, I would like to ask you permission to use this video for educational purpose and on internet. Would that be okay?
Yes.
Okay. Now, tell me first about your symptoms before the surgery. We did a 2-level fusion with the OLLIF technique 10 months ago. What were your symptoms before the surgery?
I had excruciating back pain, lower back pain.
Tell me about that. 1 to 10, how bad was it? How long?
It was, out of a 1 to 10, I would say it was at least an 8 or 9.
8 or 9,
and
wow.
It would be, I couldn't stand for
Yeah.
very long. I couldn't sit for very long. It really affected my life.
How far could you walk with that pain?
At the most, maybe a half a block.
Okay. The pain was, you said, somewhere between 8 and 9, right?
Mm-hmm.
Okay. Now, at that point, did you have leg pain as well?
I had numbness in my right leg.
Numbness in the right leg. You just showed it to me. Do you mind to show it one more time?
Numbness through here,
How long did
down in the back of my leg and my foot.
How long did you have that numbness?
I don't know, at least a year or more.
A year or so. Now, it is important because obviously that was all based on the pressure on the nerves in the bottom to disc. And I want to turn around and show it actually. And here, you didn't get a small surgery. You got a big surgery. And this is literally, we put screws in those levels. Here in the back of the bone, here, the bone is growing beautifully. And here, this is the front view, and the bone, you see the white going across, the bone is growing, and here the side view as well. Everything is perfect, bone is growing. Look at that white that goes through is the bone growing here. You see that there. So the surgery achieved its goal.
It did.
The bone, but tell me about on the pictures, but on you, how do you think the surgery achieved its goal?
The pain in my back is no longer there. I still have some numbness in this leg, which bothers me.
So let's talk about the back pain though first.
Okay.
When did you notice the back pain is gone?
I would say it was almost immediately after the surgery.
So you noticed, obviously after the surgery, I'm sure you had some pain, but you noticed that pain was different.
It was different. It was more
surgical
on this
pain.
side.
Yeah.
And surgical pain.
Surgical pain. Now, there's a saying that, usually the sharp pain that goes down the leg is first thing to go away. Many patients tell me exactly the same thing, that they have new pain from the surgery, but they notice that's different. We have a saying as well that about the same amount of the time that you had the symptom before the surgery regarding numbness and weakness, that is the time amount that it takes for the symptom to get better. So we are just 10 months after the surgery.
Right.
I'm hoping that thing with the numbness on the right side will still get better. But compared to before the surgery at this point, is it the numbness part? Is it?
The numbness is less than what it was prior to the surgery.
But it's not gone.
But it's not gone.
But again, nerves grow about an inch a month. So you can imagine for them to grow that long, that makes sense that it's going to take sometimes a little longer. But now as well, we have a new problem. Now I ask you to show me, you have some pain in the back, and that pain, at least on my sheet, is recorded as 0 to 3.
Right.
On the left side of your hip.
Yep.
Do you mind to show me where that pain is?
It's right about here.
Right about there. Okay. Now, that is actually, you're not pointing to your spine.
No.
You're pointing to
it's
what
up to the side.
Yeah, you'll notice that is different than the pain you had before, right? Okay, and that is you're pointing exactly to your sacroiliac joint. If you hold this, I want to show to everybody where the sacroiliac joint is. We got the surgery for this level and this level. You have two sacroiliac joints that practically that the joint when you give birth to a baby opens up the pelvis. Besides that has no function. And almost half of the people who have spine problem have sacroiliac joint problem and vice versa. And especially after the surgery, that rate can be even higher, meaning that people who have a surgery on their spine, we don't know exactly why, but they end up having more sacroiliac joint problems. Some people say it is because sacroiliac joint has to take more stress. Some people say because the problem was always there and then it is just now coming to light. And some people say as well that your body now concentrate to pay best posture and attention to spine and neglect the sacroiliac joint. But whatever it is, this is a common problem, having this kind of issues after spinal surgery. And the way to find out is to put a needle as far away as possible from the spine, the bottom part of the joint, in a very specific way, and just numb it up. If you numb it up and pain temporarily goes away multiple times, then it's no question that the pain is coming from here. If we numb it up multiple times and we are sure in the right place, so it has to be done in a certain way, and if you numb it up but the pain doesn't go away, then it's not coming from here.
Okay.
And treatment for that has been much more straightforward these days, and we have a good solution for that. But again, we talked about that. I'd recommend it to you not even get an injection. Do you remember why? Because we can do only few of that a year.
Right.
And for pain has to be more 6 or above for us to really for it to be worth to do the injection.
Okay.
So at this point, your pain you're telling me is 0 to 3, correct?
Well, it can get higher than that, but right now it's between 0 and 3.
If every day pain there is 6 and above, you should do injection. If it's not every day that the pain is that high up,
okay,
then we should keep that injection for the time that pain is truly become worse. Because for simple reason, number one, we can do only few of it a year. Number two, part of the diagnostic part of the injection is that you have pain, we numb it up for the pain to go down. If the pain is very low, it's not much lower to go, then we cannot really diagnostically use that injection as well. Does that make sense so far? Excellent. Now, so overall, so far, happy with the back surgery? Any question regarding that?
No, I am happy with the back surgery. Like I said, I don't have that pain, intense pain I had before.
How long did you stay in the hospital?
I went in on
You don't remember?
No, I think I went in on a Thursday and went home on a Saturday.
Okay, so 2 nights?
Yeah, at
Where
least
did
2 nights.
Where did you do the surgery?
Where did I do the surgery? Here, in this hospital, yes.
Okay, so I have the record of the surgery. I'm opening it up for us. And I understand that before the surgery, even we did a discogram, right?
Yes.
Oh, that would be interesting. Describe to anybody who want to listen to that how the discogram.
Extremely painful.
Talk about it. What do you remember?
It varied on which disc they hit first, and they went, I believe it was from the lowest one up to the highest one. And so each time they injected...
there is me. I caused you pain.
Yeah, you caused me pain, yes. And every time you injected, it got worse to where the worst disc was at.
See, we did a discogram for 3 of your discs, but then we found out only the bottom 2 are causing a problem, and that's what we fixed, and it worked.
Yes.
Without the discogram, we weren't sure which disc exactly causing your problem.
Right.
And the value of that discogram was, number 1, we were sure that's the problem, and number 2, that we don't have to fix 3 discs. We just
had to fix it 2.
Because we provoked that joint, that disc, with increasing the pressure inside of the disc. And so practically it's like putting air in a flat tire, seeing how many holes are there. And we decided the bottom 2 are worth to fix it.
Right.
And that's what we did.
Yes.
So it's a painful study, but it was worth it.
It was worth it in the end, because then we were able to pinpoint more what was going on.
Many of my colleagues literally telling me, or telling in conferences, if you have only back pain, never do surgery there. And as well, they say discogram, I don't believe in discogram. But you are an example, number 1.
Right.
It's worth to operate on the back pain alone. Number 2, the discogram does have a very great diagnostic value. I have thousands of patients that can testify to that, but you are just one of them. But I'm sure, did you ever talk to another surgeon regarding this problem? This problem that you came to?
Not in my back.
Oh, well, you're in that regard, you're lucky in that regard, because many patients go years from surgeon, they go through 2 to 3 surgeons before they find a surgeon that does believe in pain, actual pain in the back, does believe that discogram can help that. Because some surgeon, and I hear that from many of my patients, that they go to surgeon who don't believe in what we call axial pain, just the back pain, or discogram, and just send you home and says nothing wrong with you, go live with it.
Well, I went to a neurologist prior, but then my primary doctor recommended you.
So what did the neurologist tell you regarding this?
Put me on medications.
That's it.
Sent me home.
Yeah. And unfortunately, you know that if you don't investigate certain things like that this thoroughly, that is actually some people do. Just put you on medication and say, go away. I'm happy you came.
Thank you.
Thank you. Okay. Okay. Thank you.